Welcome to Civil Discourse, a podcast where participants are free to share their ideas, empathize with other perspectives, and who intend to advance to a better solution to fix a societal ill. We will focus on topics that are particularly complicated. In a time where information is from sources more opinionated than ever, our mission is to find solutions and goals to accelerate the nation's progress with cultural impunity. I'm your host, Todd Furniss. Hello, this is Todd Furniss. I'm welcoming you to Civil Discourse, hosted by Todd Furniss. My guest today is Dr. Scott Conard, who is an old friend and a mentor of sorts in the healthcare space, and somebody who is, by any definition, an expert in this field. He's a published author, he's an entrepreneur, and a dear friend. So, Scott, welcome today. Thank you for joining us.
Thank you, Todd. I'm so excited to be here.
So, you grew up in the field of medicine, and you started off as a primary care physician, but you've also spent some time writing some books. Tell us a little bit about some of the books you've written thus far. I think they're very intriguing. It's
kind of you to say that. I really appreciate that, Todd. So the reason I wrote the book is that in 1996, what happened was that I had three patients that I cared deeply for die, and they were all in their 40s. And I got very, very clear that the way U.S. healthcare was organized and what was going on really didn't work. And we needed to change from a how do you feel to a what's your risk kind of a way of thinking about things. And so reinvented the practice, grew like mad, incredibly successful, was able to do a lot of fantastic things. But in that process, what I got clear on is that a 7-minute visit or a 15-minute visit even with an individual wasn't enough to have them get the care that they needed. So what I did is I wrote my first book, which was the 7 numbers, and really was meant to hand my patients and say, hey, when you have an issue in one of these numbers, just read that chapter, not meant to be a long exercise at all, and then let's talk. And so I'd see them, we'd go over what was going on, they'd take that, they'd look at it. Usually they really enjoyed reading that chapter, so they ended up reading the book, which it's not long. And then they would say, but Dr. Conard, I just don't want to take a pill. I'd like to, do other things too. And what can I do? So I wrote the second book, The 7 Healers. And that one is a book that really looks into the way that we can pull health into our lives and get rid of pills and medications, avoid procedures and things. So those are the first 2 of the 7 that I've written so far.
Well, and I of course, drew heavily when I published my book called The 60% Solution. I drew heavily from your book, which used the acronym TROUBLE. Can you talk a little about TROUBLE?
As you know, right now, Todd, if I were going to have a heart attack in the next 5 seconds even, or a minute, let's say, and you said, Scott, how do you feel? What I'd say is I feel fine until I didn't. And at that point, it'd be too late. I'd be having a large heart attack. So it's miraculous how the human body does so well before we know there's a big problem. But the numbers don't lie. The blood doesn't lie. And if you look at your numbers, you'll look in your blood, you'll find the telltale indicators that you're within 5 to 10 years of having something horrible happen. And, most of the time when you're looking at those numbers, you're in your 40s and 50s, you're not ready to call it a day. So it was very, very engaging and very motivating to have people start to think about their health in a different way. And as you said, it was I made an acronym called TROUBLE. T is for training, which is your level of fitness, which, exercise is the best medicine for the human body. And being fit and in shape is the best predictor of longevity. R is for roundness. That's particularly the waist circumference, or how big around you are right at the belly button. But it also is really pointing to the fact that in America today, we have literally unlimited calories, and we tend to take in a little bit more than our bodies need relative to our activities, and we tend to gain weight. And as you know, Todd, we're born with a certain number of fat cells, but by the time we get to be 4 years old, we don't grow new fat cells. The ones we have just get larger, smaller. And so at some point, when you gain weight, the way Americans do, your fat cells are now full, which causes the energy in the blood, which are the fat and the sugar, to start to accumulate in the blood. And that's what the O is for oil accumulating. That's your cholesterol. The U is for unacceptable sugar starting to go up. And of course, you can imagine with all that floating through your blood, it's thick and sticky. Not really, but as a model for people to understand. And so it causes an increase in the pressure. So B is for blood pressure. And of course, all that's because of lousy habits, which are made worse if you're sleep deprived or you're smoking. And that leads to exploding plaque, which if it's in your neck, that's going to go into your head, the blockages, and that's going to cause a stroke. If it's in your chest, that's going to be a heart attack. So it's TROUBLE, training, roundness, oil, unacceptable sugar, blood pressure, lousy habits, and exploding plaques. And there are numbers that go with each of those, or metrics, I might be a better way to say that. That goes with each of those letters. And a person can follow those numbers or metrics and very quickly determine where they are in the spectrum of health and well-being or the lack thereof.
So we'll rib you a little bit later on the marketing quality of the acronym, but I think the real salient piece here and the substantive issue in what really intrigued me by the acronym was in fact something different altogether, which is you're trying to get people to be proactive in managing their health, which is very, very different for most physicians in that I think my argument would be anyway that a lot of medicine is really anchored around reactive medicine, meaning I only need to see you when I've got a problem. And what you're saying is, no, you need to get ahead of this, and which is why you were very influential in my opening chapter on primary care. You need to get ahead of this and proactively manage your health so that you're you're getting ahead of problems before they occur.
Absolutely. And, I really enjoy your book, Todd. I think it's fantastic. And I would encourage everybody listening to make sure to go get a copy. The 60% solution is exactly what we need to be focused on. And as you're saying, once the cat's out of the bag, once I've had that heart attack, that stroke, once I've got diabetes, I'm having blindness, kidney failure, amputations in my toes and feet, it's obviously our healthcare system is overwhelmed and we can't afford as a society to allow things to get that far out of control. And the wonderful thing is that 80% of the money that we spend in the United States is due to chronic diseases or related to chronic diseases. And those follow a set pattern that go 5 to 20 years before there's a problem. So I was really clear that with my patients, the choices that they made and the lifestyle that they had was going to put them in a position to win or lose. And so I'm not a person who lets doesn't change my oil and doesn't change my air filter and waits to have a flat tire before I do something about it. And I hope the people listening aren't either. Why would you do that to your body when you wouldn't do it to your car?
Well, I think you're spot on. And, one of the things that we've talked about in the past is obesity and how problematic that is. The CDC put out a study the other day, or this is like 2 weeks ago now, that said that something on the order of 38% of all people who were hospitalized, intubated, or who died from COVID were obese. And so obviously it's not the fact that they have extra weight, it's all of the strains that extra weight puts on your body, the manifestations of everything from high cholesterol, the bad cholesterol, to challenges with your cardiopulmonary system and other problems in terms of the pressure put on your other organs, et cetera. And I learned this morning, I was doing some research for a different purpose, that the state of Alabama, over 36% of their population is characterized as obese, and that there are 9 other states or so with obesity rates in excess of that. So when you talk about being proactive about your health, I think you're also talking about individual responsibility and getting ahead of those issues as well, right?
Absolutely. The thing is that nobody gets up in the morning and, says, I think I'll gain weight and become obese today. I mean, it's just a general lack of understanding on how the human body works and what's possible, and also how habits work and how you can lean into doing things a different way. It takes no more energy to maintain a bad habit than a good habit. So that's just to figure out how we turn that around a little bit. And, it's interesting, Todd, because before a person gets hypertension, diabetes, high cholesterol, heart attack, strokes, diabetes, kidney failure, liver, kidney failure, and blindness and things that we've talked about. There's a state called metabolic syndrome, and in Japan they call it metabo. And they actually, in Japan, if the people in your company are developing metabolic syndrome or metabo, they put another tax on your corporation. And what that has done is it has set up a situation where the corporations have taken more responsibility to create more active workplaces, to have healthier food, to discount healthier food versus the less healthy foods, and create a whole culture of helping people not go into that place of a metabolic disaster. And by the time you get to a BMI of 30, which is what the definition of obesity is, unless you're a weightlifter and incredibly fit, which is relatively rare, you're going to be at metabolic war. And what that means is when you take in food, it kind of goes in your mouth, in your stomach, into your blood. And now you've got cholesterol and fat floating through your blood. There's no room in the end. So you've got your pancreas on one hand trying to get it out of the blood. You've got the fat cells on the other hand that are absolutely stuffed and they don't have any room. And there's a battle going on. And literally a person it blows up or is destroyed from the inside out. And that's what we see now with all of these metabolic conditions. One other quick comment, Todd, is you were talking about COVID. I think most of us at the beginning of COVID thought we were going to see a bunch of asthmatics and COPDers in the ICUs. But it was surprising a month into it when the ICUs were starting to fill up. It wasn't the people with respiratory problems. It was the people with metabolic syndrome that were disproportionately high in their in COVID and COVID morbidity and mortality. So that metabolic war I just talked about actually not only predicts diabetes, hypertension, high cholesterol, and the other things, but it predicts a failure of the immune system to be able to protect people from COVID. So it's sad and it's a choice. The thing is that we don't have to go there if we can support and help people with social determinants as well as personal determinants to get things to goal.
So one of the things I know you do, because you've shared this with me, is I know you develop plans for companies. So you're the chief medical officer for a large number of companies, 30 plus or so. Tell me how it is to get people engaged in their own healthcare and what challenges you face in that. So we've talked about personal responsibility, but how hard do you find that to be as a chief medical officer and otherwise in your observations as a practitioner?
It's really fun, to be honest. I love it, and I wouldn't do anything different. And to be honest, how it is for me, Todd, is you have the personal determinants of health, and that's what we're talking about. And there are 3 or 4 major things. First of all, you've got to get your numbers, know your numbers, and to the degree you're capable, keep them to goal. Number 2 is you want to get your cancer screenings, and colon cancer, breast cancer, cervical cancer. They're the top cancer, and lung cancer would be the 4th one, are the most prevalent and severe cancers in terms of in terms of numbers, and that's the number of people who are affected as well as the number of dollars spent. So there's a tremendous amount we can do about cancer that we're not doing today. But on the other side of the coin, so those are personal determinants. And on the other side of the coin, you've got the social determinants. And when we talk about those, of course, we're talking about how our communities function and food deserts. I know you've done a lot of great work around the United States in finding those. But between the personal determinants and the social determinants are the corporate determinants of health. And those are the things that corporations can do to add years to the life and life to the years of their employees and their family members. And there's a large number of variables that corporations are choosing to either lean into and pull the levers or ignore. And now, because of the cost of healthcare, more and more companies are willing to ask the question, what can I do? And we're not talking wellness programs. Wellness programs, honestly, are more around the culture of the company. We're talking about things like, are medications affordable to employees? Do they know where to go when they have a problem? Are they going to the top doctors? Are they going to, Dr. Butcher, who's going to do neck and back and hip surgery on every person you can, get to come in and get surgery done? Are their formularies leading people to better medications, or are the formularies having them get low value medications that cost a fortune and actually bankrupting the middle class with the way that many things are done today? So there are many, many corporate determinants of health, and I have the honor of working with corporations to put those in place. And I will tell you right now, I'll take the challenge of anybody listening to this. If you haven't leaned in and you haven't done this work, I would virtually guarantee you that in the first year, we could save 10% of what you're spending on healthcare just by taking simple fraud, waste, and abuse out of your system. It's that bad in terms of what we got going on right now.
And that's an astonishing number. I mean, 10% in year one is an amazing number for most corporations. Healthcare costs and really benefits programs for employees are usually one of the biggest line items on the profit and loss statement for any company. So to say you can take that kind of a chunk out of it is enormous. And I applaud that work. It makes all corporations more efficient, but more importantly, it's a real tangible benefit to the people working there. I mean, you have to have genuine compassion for the employees, which, it takes you to a whole nother level in terms of the quality of the relationship between the employer and the employee. If you can convey that message and convey that warmth and that compassion, I think it's going to benefit the company, its vendors, its customers, and the value proposition it's able to offer and the innovation in the company, virtually every dimension of the corporate's existence.
Well, I've been in practice now for a day or two, about 35 years of day or twoza. So, Todd, when I went into practice, about 10% of what was spent in healthcare went to middlemen. You want to guess what the amount of money is that goes to middlemen in the United States today?
It's a big number.
It's 30%, and it's tripled. So, the reason I'm so confident that we can take money out is because if you go to the HR directors, the CFOs, and the CEOs of corporations and say, tell me about your contracts with PBMs. Tell me about your contracts with third-party administrators or insurance companies. The truth is, not one of them has ever read it. And we have a 16-point assessment we do where we look at 8 contractual issues and 8 clinical issues. And if you take the contractual issues, we generally find somewhere between 10 and 20% of the expense for corporations is pure contractual issues. In other words, we can go in and do things like, here's a fun one for you, Todd, you'll appreciate this. Insurance companies will make mistakes with the auto adjudication of claims. So let's suppose that they get a claim for, $300,000. It runs through their system. They actually brag about the fact nobody looks at it, and it is automatically adjudicated. They pay out, let's say, $200,000. Oops, it turns out that person was no longer covered, and they shouldn't have paid that money out. So then they go collect that money back from the hospital and say, we made an error, the patient was covered, so forth and so on. And over time, they're able to collect, let's say, that money back. Then they charge the company 40% of what they collected back in a fee for doing the great work of collecting the money they shouldn't have paid in the first place.
Unbelievable.
It's crazy, isn't it?
Yeah, that's just unbelievable. Not surprising, but unbelievable. So I had a discussion earlier today where I was talking about my EOB statement. So I got an explanation of benefits. The payment was listed as 1/4 of one page. The other 8.5 pages was how to dispute it.
Yeah. It's such a broken system. It's so upside down. So, when you can go through and you can eliminate 2 lines of a contract and save a company, hundreds of thousands, if not millions of dollars. And then you also appreciate the fact that the game that corporations have had to start playing, because it is the second largest line item on any service corporation, usually the second or third if it's a manufacturing corporation where they have cost of goods sold they have to pay for. The game that they've had to play is to shift the costs over to the employees. I'll never forget, I have a company that's a conscious healthcare company, and they had a 20% increase in their premium come through. They're fully insured. And what they did was they did a pass-through so that the majority of the increase went through to the employees and their families, so that after negotiation, their increase in their premium was zero, but the increase in the cost to the individual members went up dramatically. I mean, literally $700,000 or $800,000 is now coming out of the employees' pockets. And my big worry, Todd, and I know you have a lot of insight into this, you're very smart around the macroeconomic aspects of healthcare, is that we're basically creating a funnel from the middle class of America to a small number of organizations that is debilitating our middle class. And whenever historically you see a middle class get devastated, not the good things don't happen to that country over the next 20 years.
You're absolutely right. And I think one of the things we've talked about a lot is just the reintroduction of consumerism and the challenges associated with not having consumerism, because it prevents mobility between the classes. And I call it economic mobility. We're limiting that because healthcare is such a tax, either overtly or covertly, on the individual employees. And it's being buried in this concept of corporate socialism that really goes back to FDR's days, when he put a cap on wages and said it's okay for you to compete with benefits, and we're not going to tax the recipient on the receipt of the benefits, and we're going to allow the deduction on the business side as a business expense for the issuing of bill or the giving of benefits. And so, we've seen the concept of healthcare insurance skyrocket since, and as a result, we have this disintermediation between doctors and patients, and that's not good for anybody. That's, that what you're advocating is right in the heart of that, and saying, hey, not only do we need to have a direct relationship, but we need you engaged. We need you personally involved in your own healthcare.
Well, it's interesting too that when you look at the money being spent in healthcare today, one of the things that I do for the companies I work with is we create what we call pathways of care, where we take a person, again, chronic disease follows a pattern. So a person, just like a baby, when a baby's born, they don't get up and sprint out of the labor suite. Neither do diseases cause heart failure, kidney failure, heart attack, strokes, et cetera, right out of the bag. There's between 5 and 20 years that you can literally go in and reverse it or prevent it and decrease the costs as well as the debility dramatically. So if you think about it clinically, and you ask the questions, why aren't people taking their medications? Why aren't people going and get medical care? Why aren't they getting the cancer screening and things that would save so much money for corporations? The answer is because our plan benefits are so poor. The answer is because our plan benefits are so poorly designed that people have insurance, but they can't go get care. So to me, it's a two-step. You get rid of the low quality care. You get rid of the fraud, waste, and abuse that is so common in our system. And then you take very high quality care and minimize the cost to people to get the great care. And what happens is they actually take care of themselves. So it's a win-win-win. The culture wins because, as you say, people appreciate the fact that their corporations are willing to go the extra mile for them. 2, the person wins because they don't get sick and have stupid things happen that didn't have to happen. And 3, the corporation saves a tremendous amount of money.
Indeed. Well, I think one of the things that's also always impressed me about you is you're very mission driven. You really care about people, and you really care about improving the quality of people's lives, and you want to engage people in that mission and that journey. And what I think is also impressive is you're also trying to undo the barriers that prevent you and other physicians from doing that very hard work, which you're all committed to. And the one constant trait I see across all physicians is this concept of mission-oriented and compassionate care that they want to deliver to their patients, and there's structural barriers to doing so that you're trying to undo.
Well, you really do understand that. I've read your book. I get that you have connected with what needs to be done. And our financing mechanism in the United States right now for healthcare is a disaster, and particularly for primary care, where the amount of administrative work continues to go up dramatically. I am a family doctor, and it's miserable to be a family doctor today, because you go take care of people and then you get the honor of spending 2 or 3 hours dealing with insurance companies and documentation and filling out forms and all of the things that that don't change the quality of health that's being delivered, except that you're trying to get the person care when you have to fill these forms out often so that you can actually do the proper referral thing. So Todd, in your book, you address a lot of the economics of how we need to change that, and advanced prepaid primary care or direct primary care that's accountable direct primary care is an example of where you take the administrative burden off the primary care doc, let them get back in the exam room, take care of people, hold them accountable on one hand, but we want to be held accountable for quality, so that's not a problem. So we get held accountable on one hand, but then we are given the resources to take care of people. And so I see a vision for the future where we have a change in the compensation to primary care, where we are held accountable for taking great care of people, but it's on a prepaid basis, not on a fee-for-service basis. And then specialists and hospitals and things may be remaining on a fee-for-service chassis. They may have to compete around quality and things, but they will be in a place where they, where there's some transparency and people can understand what they have to offer. Because there's some great, the United States has the best healthcare in the United States, but we also have the worst healthcare the United States has the best healthcare in the world, but we also have the worst healthcare. We're a marketplace. We're not a system. We've got to let the high quality providers compete, and we've got to find a way to support primary care. And I think your book outlines a lot of very important principles in making that happen.
Well, I really appreciate the hard work you're doing, Scott, and I'm grateful for the conversation. I could talk to you for another 4 or 5 hours, but I know your time schedule doesn't permit that. Underneath there is a banner where you can reach Scott and how to connect with him. And in the notes for this podcast, we'll have a listing of all of Scott's books. I encourage you to read them. I'm a particular fan of Trouble and the seven numbers, so I encourage you to read that one. But Scott, you've also got another book coming out. Have you got a working title for it?
Yes, we do. It's Intuitive Wellbeing, Winning the Game of Health. And that comes out in June. And it will really talk about not just what there is to do, but how people can successfully win the game of health. All of us know what to do, but the truth is that we don't do what we know. And this book is really leaning into how do you put what you know you need and want to do to live a long, great life in place and add years to your life and life to your years.
Fantastic. Well, I hope you'll do me the honor of allowing me to bring you back when you're getting ready to launch the book, and we'll chat about that in detail.
I'd love to. And thank you so much for your hard work and for the mission of your heart and getting out there and really increasing the conversations around what a functional, actual system in the United States would look like when it's put in place. Thank you, Todd.
Well, thank you, and we'll look forward to talking to you soon. Thanks for watching this week's episode of Civil Discourse. To learn more about today's topic or our guest, visit www.the60percentsolution.com or www.tfip.group.